Diabetes is quite a puzzle, and so that's where I just want to give you guys the opportunity, kind of a general overview of what diabetes is, because I know you see a lot of it in your profession. There's over 200 million people with diabetes in the world right now, and in 2030 they're expecting over 400 million people to be diagnosed with diabetes. So this is a huge problem. It's a problem all over the world. Working with someone who has diabetes or managing it yourself, it requires a lifestyle change. Anywhere from naturally the diet is important, the sleep cycle is important, exercise is important, stress relief is important. It encompasses every part of your life. It has to be monitored and things have to be changed to help control the diabetic cycle. So let's talk about what it is. Diabetes refers to the number of diseases, but the common type is type 1 and type 2 and gestational diabetes. Type 1, as I said earlier, is the insulin-dependent diabetic who without insulin would not be able to survive. Type 2 is usually controlled with oral medications and has to do with the ability to accept the insulin into the cell. I'm going to talk about that in just a second. Gestational diabetes, I'm sure most of you have heard about, is the diabetes that pregnant women get. The placenta throws off hormones that reject insulin to protect the infant, or the fetus, excuse me. And sometimes those hormones get into the mother's system and they reject the insulin, and so that's how they become diabetic. Then once they have the baby, that's resolved because those hormones are removed from the body. However, unfortunately for these women, they are at a very high risk of developing type 2 diabetes as they grow older. Okay, type 1 diabetes is considered an autoimmune disorder. So the pancreas has islet cells which produce insulin, and the insulin is kind of like a shopkeeper at a store. You know, the shopkeeper comes in every day, unlocks the door, opens the door for the people to come in and buy things. The buyers mull around the store, they pick things off the shelf, they go to the cash register, they pay their money, and what does all that do? It keeps the store going, and it fuels the store. Well, that's what insulin does. Insulin comes to the cell, it opens the door, the sugar comes in, it feeds the cell, and the cell can do its job. So that is how insulin works in the body. Type 2, and so if you don't have insulin, the sugar is going to be mulling around in your blood system and not feeding the cells, and that's how a person gets so sick. Type 2 diabetes is a little bit different. The pancreas may make insulin, but the insulin may be ineffective, kind of sluggish, not helpful. It may not make enough. Sometimes the insulin, which is, again, unlocking the cell wall so that the sugar can go in and feed the cell, the receptors might be a little bit off. It's kind of like having a blow dryer on a camping trip. You've got your blow dryer, you've got your power cord, but you don't have anything to plug it into. You plug it into a tree, it's not going to work. So that's kind of how type 2 diabetes can operate. And the oral medications help open up the cell so that they can accept the glucose. Now, that is not the only explanation of type 2 diabetes. There's several reasons why people get it. A lot of times they carry a lot of abdominal weight, and that weight on the pancreas is not healthy. And the islet cells can't produce as much, or the insulin may not be as good, and they may not produce any. But the way they keep track of diabetes for people is to do the pre-diabetic screening. Has anybody ever heard of pre-diabetes? Guys ever heard that term? Well, as we age, and I bet everyone in this room will experience going to the doctor and they'll do a hemoglobin A1C. And what that indicates to the doctor is a 3-month average of your glucose. Now, they don't give you a glucose average, but they give you a score, a hemoglobin A1C score, and it's a percent. And they used to want it to be below 7. Now they're backing it up, and they back everything up, blood pressure, everything. They're backing it up, and it's at 6.5 now. So they want anybody to have a 6.5 or below hemoglobin A1C. If you creep up to 6, then you're pre-diabetic. You really want, to not get that pre-diabetic diagnosis, you want to be 6 or below. Are there any questions about that? Kind of complicated.
If you get a diagnosis of pre-diabetes, is there anything you can do to back down?
Oh, absolutely, absolutely. If you're diagnosed with pre-diabetes, that is when you go and you focus in on that lifestyle change. Your stressors, and we're going to talk about that in a little bit, your diet, your exercise. In truth, and I think this is in one of the slides, if you are pre-diabetic and you can lose 10 to 15 pounds and you exercise 30 minutes 5 times a week, that will reduce your risk of becoming diabetic. So yes, there is definitely hope. There's a lot of complications that come with diabetes, and we are going to talk about that in a minute. Environmental and lifestyle factors are what are blamed on diabetes, or blamed for diabetes and getting that diagnosis. As I said, type 1 diabetes is an autoimmune disorder. That pancreas just flat out isn't going to make any insulin. And so it is increasing particularly in America. And it may have something to do with the chemicals that we're exposed to, or we're taking something out of the environment. Who knows? Nobody knows what causes autoimmune disorders, but the immune system attacks those islet cells and they're rendered dysfunctional. The warning signs, if these are something to be aware of. And here I am, an RN. My son, he was 9 years old, and we had put him on, or not we, but his doctor had put him on steroids because he was having an asthma flare-up. Well, that was like on Friday. Over the weekend, he just got really lethargic. He had been urinating a lot, and he was drinking a lot, and it was summer. So we didn't think, no, actually it wasn't summer. So, but anyway, him drinking a lot, we didn't really pay attention to. He was drinking a lot, he was urinating a lot, and it was no big deal. And then he became very tired and lethargic. And over the weekend that he had been given those steroids, I thought, well, maybe that increased his blood sugar, and he's just feeling that from the steroids, because that's a result of taking steroids. Took him to the doctor on Monday, and he was diagnosed with diabetes. His sugar was about 900. Well, that's not from steroids. That's just, obviously, it had been coming on, and we didn't recognize it. But unusual thirst, the frequency of urinating, the blurred vision. There again, my son, right before he was diagnosed, had to get glasses because he couldn't see the blackboard. Feeling very tired and extremely hungry. Oh my gosh, are diabetics hungry? Why are they hungry? Does anybody know? Because their cells aren't getting the glucose that they need for their fuel. So the body's saying, I am starving, put it in there. But they put it in there and their body can't use it. So it's just mulling around in their blood system and not getting into their cells.